Hello everyone, this is your Krishna from Women Today YouTube channel. In this channel, we have been interviewing many women entrepreneurs. We are just traveling to different cities. We are just doing offline interviews, and we are also doing online interviews across different cities in India and also across different countries in the world. Today's our guest is from Maharashtra, from Sangli, and her name is Anjum, a dietitian and also a nutritionist. I welcome you, Anjum ma'am, to this Women Today YouTube channel. Please kindly introduce about yourself, about the kind of work that you're doing to the audience who are watching this interview right now, ma'am.
Thank you so much for such a beautiful introduction, Krishna. So I am into this field since last 4 years. I'm a clinical nutritionist or clinical dietitian, we can say, and I'm attached with multi-specialty hospitals since last 3-4 years. And along with that, I'm also doing my private practice. So my forte is mostly about medical nutrition therapy. So there are a lot of things going on about diet, lot of influencers, lot of fad diets, and lot of misinformation also present on internet, right? So I try to correct that gap by bringing the more professionalism into it. And my focus is mostly on the clinical nutrition part regarding the patients, about the starting from the recovery after the surgery or pre-op preparation for the of the patient nutritionally for the surgeries. And apart from that, again, weight management, hormonal management like PCOD, PCOS, thyroid, all of these things I try to cover up with diet, and I try to make the individual healthy in terms of at least in terms of healthy nutrition.
That's a great introduction. Also, at what point of time did you
Mhm.
mention that you wanted to become a nutritionist or dietitianist? What inspired you to become a nutritionist or dietitianist, ma'am?
Actually, I didn't plan to become a dietitian. I just was curious about the food components, about the nutrients. I had one topic in my 12th standard science, in chemistry, of course, and that was biomolecules. So the topic was not a bigger one, and it also carried a very low weightage, but it was very interesting to me. So I started reading from there: what is carbohydrate, what is protein, what is fat, and from that there was some curiosity, and I didn't plan to become a dietitian, but there was something in my mind, like back of my mind, that someday maybe I'll learn uh, about all the foods, where the carbs are coming from, where the protein is coming from, and how much is the composition. Because it is food is like a medicine. If we are learning about medicine, we should also learn about food. That was just a part of curiosity. Then after 12th, I don't know, somehow the destiny pushed me there only, but I did it well, like I did passionately, and again the interest got developed, the interest actually grown more and more. So that's how I came into this. Actually, I planned to become a doctor, but I came into becoming a dietitian. It's just like that. But I'm just enjoying this thing.
Yeah, always a person who is enrolling themselves into a biology department in the high school wanted to become a doctor, but at one point of time, either because of some kind
Yeah,
of circumstances, because of it may be because of marks, it may be because of any other circumstances, they will be diverted to some other field. But
yeah,
they are very happy to enter into different fields
yeah,
which is truly like attached to medicine. Like they may be becoming a dentist, they may be becoming a dietitian or nutritionist like you,
yeah,
they may be becoming even a physiotherapist. So a lot of things are kind of
yeah,
going and joining with the department of medicine. That's a great thing, man. So also there
yeah,
will be a lot of approaches when people come to you,
yeah,
and they'll be telling that, madam, I want to go through
yeah,
a weight loss, of course. So each and every people, they'll
yeah,
be handling their clients in a very different way for weight loss. So tell me, ma'am, what is your
yeah, yeah,
approach,
yeah.
and how do you actually train clients for their weight loss in a very healthy manner, ma'am?
Okay. Actually, my approach is about weight loss is totally science based. It should be sustainable. The diet should be realistic. So I mostly focus on improving the metabolic efficiency of the client. I try to correct their meal timings. I try to educate them about the portion control or the portion balance of food. And in the weight loss journey, I try to maintain that the muscle is not lost, only the fat is lost. So that's how I try to do. And apart from that, again, I try to fix their sleep. I try to understand the stress and try to manage it all as well. And along with that, I also monitor the hormonal contributors too. So I am not a fan of extreme diets like fat diets or something like that. So I try to teach the clients also. I try to teach them like how to eat in real life situations, how to handle the plateaus. So when a person is on weight loss journey, there will be a lot of plateaus on such days or such weeks. Sometimes the plateaus of months also, where the weight is not at all lost. So I try to teach them how this, like I to keep them patient at that point of time. And again, I try to teach them like how to maintain results even after the program ends. So that's why most of my clients don't regain their weight once they stop active coaching. So I try to keep the plan mostly sustainable and realistic based.
Yeah, that's very good manner to actually balance your clients by just accepting the kind
Yeah.
of diet chart that you're preparing for them. So tell us, ma'am, there will be a lot of things happening when you follow a particular diet chart. And people who mainly
Yes.
have thyroid issues, when they're following a particular diet chart, they'll be having a lot of hormonal imbalances. So tell us, how do you make
Yeah.
sure that you balance these kind of hormones, and there is nothing, any kind of side effects for people who are having any kind of thyroid issues when they are following your proper diet chart that you have categories for them, ma'am?
Okay. Firstly, I try to assess their hormones because hormonal disorders are not just about one hormone. So I try to assess the hormones, like I try to assess the insulin resistance. Then I try to access the cortisol levels, which is a stress hormone. Then again about the gut health. Again, I have to see the sleep quality of the patient. Then again, I have to monitor about the micronutrient deficiencies. So the way I tackle this for my thyroid patients, so my approach mostly includes I try to include anti-inflammatory foods, low glycemic meals. I try to optimize the fiber intake, improve their protein intake, and I again try to maintain their sleep properly. I try to make sure that they are having a proper sleep, deep sleep, and they're stress free. And exercise planning is suited to hormonal health, like not overtraining also, because overtraining is also not going to give any benefit. So the goal is to have to control this symptom and a long term uh, hormonal balance, not just weight loss. So that's how we try to manage.
So also you were just speaking about fiber intake and also about gut health. So tell us,
Yeah.
ma'am, what do you actually mean by gut health? Because gut health is the most important thing in our body. And also tell us, how does this gut health actually make an impact in our body? So tell us about it, ma'am.
See, the 70% immunity cells are stored in the gut. So it is the second brain, we can say. So gut is nothing but the foundation of immunity, metabolism, hormones, and even mental health. So if digestion, absorption, or even the gut microbiota is disturbed, no diet will work effectively. So if I see gut as the starting point, not just something it should be considered, it is the starting point of it is the starting point of starting of any diet. So especially when the client comes with the complaint of bloating, acidity, some clients may have autoimmune conditions. Then again, PCOS, thyroid, all these issues they also arise from gut only. So gut is the major thing that you can't really ignore it. It is the starting point of health. That's it.
So tell us, ma'am, if a person is coming to you and if they're having mainly gut health issues, so how do you actually start preparing
Mm-hmm.
diet, and how do you actually help them in the beginning? And what supplements would you give them so that it will be the beginning stage for any person? So people who are watching this video right now, they'll be having a lot of gut health problems. So tell us, as a beginner,
Yeah.
what are the foods, what are the supplements, what are the diet that you would like to recommend to them, ma'am?
Firstly, I try to listen to their symptoms, what they are feeling about food. Firstly, I try to listen what complaints they are having regarding food, and especially based on if suppose somebody is eating some food and they are getting irritated, they are getting some symptom. So I try to remove that irritant first. So the irritant could be anything, any processed food or any triggering item. Sometimes even the spices, sometimes the milk. These are we call them as irritants for some patients depending on the symptom. So we try to remove the irritants first. Then we try to improve the digestion. We try to fix the meal timing. Then we try to educate the patient about the type of like hydration, how much they should have, and about the chewing also. Like if they're not chewing properly, even the food is not digested well. So again, I try to restore the gut lining through diet, then support microbiota. Like with food first, supplements only when required. I generally don't recommend supplements early on. Firstly, I try to correct it with foods, and only when it is needed, only then I use the supplements, and never blindly. Especially, I try to correct it about foods because most of the our foods they are functional foods and they will work well if they are given in proper amount and in proper way. So supplementally, I try to
So
assess
yeah,
these things.
yeah, there are certain food sensitive materials and also food intolerances happening. So tell us, what is the most common
Yeah,
thing
yeah.
which makes us for the food to be
Hmm.
intolerant to the body? What is the most thing which is causing harm for the gut health? And also tell us what is the most common food that we can intake
Hmm.
in order to maintain all these kind of gut problems. So tell us what is the cause for gut health problems, the foods which cause gut health problems, and also tell us what should we intake in
Hmm.
order to avoid all these gut health problems, ma'am.
Now, see, it depends. First of all, it depends on the individual. The food sensitivity of you and the food sensitivity of me is totally different. Some foods I may be intolerant, but you are tolerant. Some foods you may be intolerant, but I am tolerant. So it depends on the patient also. So for that only, we need to understand their symptoms. There's no one common food. But yes, just to improve your gut microbiota, prebiotics and probiotics can be included in diet. So that's what the most common thing we can do. But again, it depends on the individual. So we try to take the detailed symptom history of the patient first because it has to be a personalized approach. Then we try to understand the food and symptom correlation, how which food the person is taking and how the symptom is occurring, and is there any correlation. So again, it depends on individual, right? And again, then elimination and reintroduction method we use. Suppose if milk is irritating your gut, right? I will eliminate milk for some days, then again, I will, after your gut is stabilized, I try to reintroduce it in small quantities. Like I'll try to give you buttermilk first. Then slowly, if we see how the tolerance is improved, then we again reintroduce the food. So that's how we assess, and it depends on individual only. So only for common foods, if you want, you can go with the pre and probiotics, curd, pickles, everything as such. So I don't necessarily label food as bad, but the goal is to identify triggers, heal the gut, and then reintroduce foods whenever possible. So the diet remains flexible and nutritionally complete.
That's really a very wonderful explanation you told right now, ma'am. Because there is, of course, there is no any kind of common food which is very food sensitive
Yeah,
or food intolerant for all kind of people. Of course, certain people do have food intolerances towards certain food items.
yeah,
That's truly right. I have seen many
yeah.
people like I have seen even my close friends. They'll be tolerant
Hmm.
to some foods, but I'll not be intolerant. I'll be totally like
Yeah,
intolerant to that particular food items. And for particular
yeah.
food items which is tolerant to me, it's very sensitive for
Hmm.
them. So yeah. And
Yeah,
also you told that the basic thing which we can take to avoid all kind of food intolerances is curd. I think that's the best
hmm.
probiotic which one can intake.
Yeah, yeah.
Curd intake. And other than curd, what is the other item, second item that you recommended for intake of probiotics, ma'am?
No, there are some fermented pickles like sauerkraut is there. Vegetable made pickles which have very low oil, which are fermented, that are also very good source of prebiotics. Even onion is a good source of prebiotics. So these things can also be included in food.
So you're talking
Again,
about
because due to
the
pungency
raw
and due
onion
to
or the cooked one, ma'am?
yeah, raw onion is good in prebiotics. But
Oh,
again, some people they don't like pungent taste. So again, that depends on the individual. So here comes the personalized approach. We have to consider their choices as well.
yeah, that's why a great nutritionist or dietitianist like you should come into action because you actually try to study the clients coming to you and you'll be trying to recommend them. Of course, pickles are the good ones because yeah, our
Yeah,
ancestors has actually made them into our proper food so that we'll be avoiding this kind of gut health problems. That's really a great
yeah.
thing done by our ancestors. And also tell us, ma'am, when a person is coming to you and they're having taking one into one like direct consultation from you, so what can we expect during this one is to one consultation? So what are
Okay.
the typical things will you be carrying on in this kind of consultations, ma'am?
Okay, so clients can expect a detailed medical and lifestyle assessment that will be done by me. And then I will clearly explain why the body is responding the way it is, depending on their lifestyle and the medical reports. So, again, a personalized practical nutritional strategy will be planned for them. And based on that, we will set some realistic goals, not any false promises like 10 kgs in 1 week we can lose, nothing like that. Realistic goals and not false promises. So, each plan is adjusted to the work schedules, cultural food preferences, medical condition. Again, some people have some emotional relationship with food. If somebody is sad, they sometimes they may eat much. Somebody will starve themselves. So this is also emotional reaction to food. Again, the way I spoke about cultural food preferences, right? Now you're from South, I am from Maharashtra, right? You might be eating rice more, I might be eating chapati more. So even those cultural differences also matter, and we can't, we just can't tell them you eat just according to me. we have to consider their cultural food preferences, because that's how they have been brought up, they have been grown up, and in their how, and that's how they are used to their cultural foods, right? So we have to consider these things. So all these things will be considered. Assessment will be done properly, and you will be screened nutritionally, and then depend. And after that, I will come to a nutritional diagnosis, like what is your nutritional condition at right now, and from there we will start with the plans.
That's a great thing. Of course, we differ from different areas, and also people in the
Yeah.
same areas they'll be preferring different foods according to their taste buds. So yeah, that's
Yeah,
better
again,
to,
there's a lot of factors. Religious factors are there, social factors are there. Pork
of
eating
course.
in Christian is fine, but pork eating is prohibited in Muslims. So these things also we have to consider. We can't label something good or bad, but we have to respect their beliefs also while doing consultations.
Fine, fine, ma'am. And also tell us any
Yeah.
kind of success testimonials that your clients had
Yeah.
after they had a consultation from you, because people always wanted to know what are the success results which is
Yeah.
got by the doctors who we approach. So tell us about your success stories that you wanted to share with the audience, ma'am.
Yeah, this one I want to share especially. I have consulted a lot of patients, but this thing is stuck in my mind. There was one patient who tried multiple ways to lose his weight, and then he landed up in some network marketing powders, which he was taking as a meal replacement shakers, and he lost his weight. He lost a lot of amount, like around 20 kgs he lost due to using those shakes. But as soon as he stopped drinking those shakes, he gained his weight again. So that thing already took him 1 year of his life. Then after that, he came to me and he was like, "I have to do weight loss, but I tried everything." He has spent literally his sold his gold ring to purchase those shakes. So till that point he went. I'll because those shakes were very expensive, around 15,000 per month or something like that.
Oh,
15,000, 20,000, like those amount of money he has spent. And when he came to me, I assessed his reports. His liver function tests were totally abrupted. They were totally disturbed. It was not good. Kidney function tests were also not good. So when we access him biochemically, when we access his blood reports, it came out he was not healthy. He lost his weight. He regained it back, but body is like it's starving for proper nutrition. It was that condition. Then from there we started correcting his condition. I tried to understand what his situation is and how his psychology is related to it. He was like, I'll do anything, but I can't lose my weight. And even if I lost, it will not, I will gain it again. So firstly, I have to bring him out of that own zone. That this is not possible. You will lose your weight. Then we slowly and gradually we started building habits. So I just introduced him to the gym. I just told him, you just do 2 to 3 days, not regularly, just 2 to 3 days, only for 20 to 30 minutes. That's it. And other times you just keep walking. And I put him into calorie deficit. But along with that, I also gave him proteins properly. Means I actually optimized the protein intake for him, and then hydration, then slowly lifestyle building. Then I tried to tell him that I tried to educate him how sleep is important and how you're missing on that. So we tried to manage all these things. And when he came to me, he was 135 kg. And within 1.5 year, he came to like 92 kg. And then again from that, he is now continuously maintaining on 87 kg. And now I don't have to tell him anything. He is educated. He knows what to do. When he is out, he knows what to eat. So I think that's important, because whole life I can't give him guidance. I have to teach him. At some point after that, he is going to independently. He's going to have these choices, right? So that's the result I always remember. So that was the client. Now he is very happy. His all the blood tests are normal. Cholesterol levels are normal. LFT is normal. RFT is normal. So that's what I think that keeps me motivated. Like without intervening any supplements, it was totally based on food.
so that's a great thing. Of course, people go through
Yeah.
a lot of things. They go to many supplements, and of course, they lose their
Yeah.
weights. But again, after some time, they get gain their own weight. And also tell us,
These are
like,
just marketing gimmicks.
yeah,
These are just marketing
it
gimmicks. They
happens.
don't try to assess.
Yeah, certain things
They
will
don't try
work
to
out actually.
understand the.
Yeah, but not most of the things that most of the people like, not 100% right. But going in
Yeah.
a very organic kind of natural kind of therapies, natural foods will actually help them, as you told right now. And also you told that
Yeah.
help them actually maintain this kind of good healthy process till the end of the life. So what are the kind of
Yeah.
things that you do to help people support the
Mm.
health in the long term, like consider like after 5 years, 10 years, like how do you actually help people to maintain their health and maintain all these kind of diet charts, that hormonal balances, and also the weight. So tell us about your kind of
The
rapport
thing
that
is,
you have with the
firstly,
clients.
no, firstly, I try to educate them. I have to tell them what is their condition. And when they give me some amount of time, no, there has to be a lot of patience from both the ends. Now, I know this will result will come, but only the part comes with the adherence. The patient or the client has to adhere to the plan, has to adhere to the habits, and that is the most challenging part. This is the world of instant results. This is the world of we can't even keep our concentration beyond 30 seconds. Our life has become like reel and scrolling. So to wait for long, the patience is not there. So firstly, I have to try from that. I have to keep pushing them. I have to be motivated by myself. I have to motivate them. Then if they give me 3 to 6 months, I'll try to build their habits. And from those habits, if they are getting results, automatically they will choose what is right, what is wrong. Now what I have to do. And they will, when they see results, no change only comes after that. So I try to educate them, just not to give them diet chart. I don't do. I think diet plan and diet chart is just 10% of it. The rest 90%, diet chart I'll plan I'll give, but the rest 90% that's the major challenge. The behavior is there, sleep is there, like all lot of factors is there. So we have to consider their working schedule, their personal life problems are there. So why they're doing that, we have to understand that, and why their body is responding the way it does. That also I have to understand. So psychology plays a role, culture plays a role, environment plays a role, work plays a role, everything, sleep plays a role. So all of these things I have to consider. We have to go to the root cause and then we have to educate them. And when you keep on educating them, we have to bombard them. Like this is thing, this is how it works. You have to do like that. So slowly and gradually and with some patience, they will understand and they will choose from themselves. So I think apart from giving charts and giving consultations, educating them is equally important.
Of course, education and the information which we give is the very much important thing which is required by
Yeah.
everyone, and also following that kind of information properly is the next step which
Yeah.
people, most of them, miss.
Yeah.
That's why they're having a lot of issues. So nowadays most of the people are having PCOS and PCOS problems and thyroid issues.
Yeah.
So tell us, what is the most common
Yeah.
thing which contributes as a factor for uh, causing these kind of thyroid issues, and also tell us how can we actually prevent them by proper diet. So tell us both these kind of situations, ma'am.
Okay, so mostly it is due to insulin resistance, I told earlier also. Then again, chronic stress, poor sleep, the sedentary lifestyle or over exercising. Both things are on an extreme are bad. Sedentary means they're not doing anything, they're just sitting like that, idle jobs, walking very less. So, sedentary lifestyle is a thing, and even some are over exercising, even that won't work. Again, there will be nutrient deficiencies and poor gut health. So, all these factors are going to contribute for PCOS and thyroid issues. So diet alone cannot fix it. Lifestyle correction is essential. It is a must. So that's how we try to do it. So we try to manage symptoms through balanced nutrition. Like I try to balance the micronutrients. There are two type of nutrients, macro and micro. So carbohydrate, protein, fat, these fall under the macronutrients, which are required in large amount. So I try to balance the micronutrients. So there should be balance. The amount of carb, protein, and fat has to be balanced. The one should not be higher, one should not be less. So you have to balance that. I try to balance that, and then I try to introduce anti-inflammatory foods, antioxidants like fresh fruits, vitamin C, which are rich in vitamin C, berries. All of these things are anti-inflammatory. They also have good fats. So I try to include these foods. Then stable meal timings. The meal timings have to be stable. They can't be fluctuating. So a routine is fixed. Then I try to tell them like stress management strategies, how they can manage their stress. And apart from that, exercise I try to tailor to their hormonal response, of course, in coordination with the gym trainers if they have, or the physiotherapist if they have. Or apart from that, I can just guide them based on that. So the aim is the symptom relief first. Hormonal correction comes next. So we try to uh, correct this symptom first, then we'll correct the hormones, and then with that, the weight will come to the normal range. That's how we try to keep the approach for these patients.
That's a very wonderful explanation. Each and everything is explained in a detailed manner, technically and also at the same time understandable. So also at the same time,
Thank you.
the main answer is, so tell us, ma'am, what are the
Mhm.
foods can we intake as a common people to avoid this kind of insulin problems, thyroid problems, PCOS problems? Because most of the people in their young age, before 40 plus
Mhm.
or before 30 plus, they'll be like,
Mhm.
okay, I have nothing abnormal in my body. But after one point of
Mhm.
time, suddenly something will be happening somewhere. So
Yeah.
of course there is many reasons like chronic stress and the work pressure, and also some person will not be working too much hard, some person will be working too hard. So what is the most
Yeah.
common foods that we can consume so that we can avoid this kind of thyroid problems, insulin problems, PCOS problems? So tell us about it now.
Okay. Firstly, you have to stabilize your meal timings. Timings is important. Sleep has to be have into a fixed time schedule. So sleep has to be the fixed schedule. And apart from that, meal timings has to be fixed. And the foods that we can include daily have to take some anti-inflammatory foods. Now, anti-inflammatory foods include the way I told you, fruits which are rich in vitamin C. So citrus fruits come or any other fruits are also fine. Then apart from that, walnuts are good source of omega 3. So this is also anti-inflammatory. Almonds are good source of vitamin E. Vitamin E is also antioxidant. So they can include these foods. So generally almonds, walnuts, fruits, this has to be included in your daily diet. At least 2 to 3 fruits per day. Even your fiber requirement will be completed through that. And fruits you can take as a snack, not with the meal. In between the meals you can take. So along with that, then almonds you can start your day with the soaked almonds, the way it has been traditionally told to us. That is fine. Then again, apart from that, walnut you can take as a snack. Now, again, these nuts are also rich in fat. They are calorie dense. So the quantity matters. So if I'm telling almonds are good, some may go and take a fistful of it. That is not advised. So again, quantity matters because these are nuts. They also have oil in it. They are calorie dense. So even that things matter.
That's
So
great.
these are the common foods. Again, at the way I told prebiotics, probiotics you can include. So salad should be there in your when suppose if we imagine a plate, half portion should be of veggies, salad or veggie. 1/4 portion should be of protein and 1/4 portion should be of carbs. That's the ideal plate and one dairy something dairy product for a probiotic thing. So buttermilk is fine. So that's how you can design your plate and meal timing should be fixed.
The meal timings should be like fixed, right, ma'am?
Yeah. But
Or
you
is it?
have to be flexible. Sometimes if suppose somebody is traveling, they can't have at that time. But at least they should carry some healthy snacks so that the time is not missed. You can at least have a snack at that time, right?
That's great. So during traveling, what are the
Mm.
healthy snacks can you recommend? Like as you told, smoke soaked almonds we can eat in the morning, but most of the people will be traveling.
Yeah.
So at those point of times, what foods they can actually intake during those travel period?
Yeah, you can carry chickpeas, you can carry roasted makhanas, you can carry nut mix. There are a lot of pumpkin seeds is there, sunflower seeds are there. You can roast them and you can carry 1 tablespoon is fine. Then fruits you can carry. Dry fruits are also fine. You can carry those. You can also make some laddus out of multigrain flours. So those laddus also you can carry. So these are the snacks which will go long term and which you can carry easily. You don't need to carry a big dabbas. Even a small pocket will be fine.
That's great. So also tell us,
Mhm.
ma'am, many clients will be coming to you, and once they come to you and they have a diet chart planned by you, they'll be going through many sessions with you. What are the transformations have you been seeing? Like you have spoken about a certain person who have undergone weight loss. So other than that,
Yeah,
there
yeah,
will be a lot of persons coming with
yeah.
you from with different issues, and there must be a lot of transformations happening. So tell us, what are
Yeah.
the transformations have you seen once a person has enrolled in your sessions, ma'am?
See, beyond physical change, what I love the most, somebody is having a negativity about their own body, but when they lose weight or when they gain their goal physique, I've seen their confidence improved. So the success in their other areas of life is also more because they have an increased confidence. They have reduced anxiety around food. Some people have an anxiety around food, like I should not eat this. I should. They have restricted themselves. So after educating them properly, they understand. No, I can have one piece of cake. That's okay. They don't have any guilt for that. So that is a reduced anxiety around food. Then better energy and productivity. When they are nutritionally well, they have good energy. They have good productivity. They have good concentration. And one thing I love the most, once they've gone through these programs, they have a stronger self-discipline. They can discipline themselves. So I've seen the better energy and productivity and a stronger self-discipline. So if you can control yourself around food, you can control yourself around anything. So these are the real transformation which is beyond physical changes that I have seen.
That's a great thing. Of course, a person who is actually psychologically well can actually control each and
Yeah.
everything. Of course, their work things,
Yes.
their success, and everything. Because once they're psychology, because that's the great transformation which we expect from people
Mhm.
when they come to you and they say like, "Okay, ma'am, because of you, I have just gone a lot through, and now I'm feeling happy." That's the best feeling which we can
Yeah.
get from our clients. So yeah.
Yeah.
So Tell us, ma'am. There will be a lot of dietitians and nutritionists like you in the society, but there must be some kind of unique things which you must be feeling very proud of yourself, which will actually set you apart from other kind of dietitians in your nearest areas. So tell us what makes you feel very proud and what makes you feel very unique from other kind of well talented professionals in your dietitianist department, ma'am.
Yeah, actually, those who have done dietetics, those are doing good. Everyone has their own approach. So I just feel ki I try to understand the science and the evidence-based nutrition, which is beyond someone's health. It is just I will not give any advice as such because I have to understand the science behind it. I have understood the science behind it. So I think I combine clinical science with practical living also. Of course, you have to be flexible. You have to be realistic, along with carrying the science thing with you. Then I focus on the root cause, not just symptoms. And of course, it needs a lot of patience. And I try to prioritize education over dependency. The client should be educated enough and not just dependent on me. Once, if I am not there, he should be able to take his own decisions about food. So that thing also takes time, but I try to prioritize education over dependency. Then I work with clients and not on them. So I work with them. It's just like we together we are working on this. I'm not working on you, but we both are working on this thing. So I try to keep them as a team. So that's how I do. So I believe nutrition should fit into life, not control it.
Yeah, of course, that's a great kind of contribution that you're doing to your clients. Of course, we should not force anything artificial, which it should be happening naturally. Like we should not take
Yeah, naturally.
medicine as food. We should take food as medicine. That's what you're trying to tell that it should actually kind of
Yeah,
impact us in the right way. We should not kind of make it force it. We should make it happen it naturally.
yeah,
That's a great kind of
yeah.
thing. That's a great understanding that you had in your dietitian profession, ma'am. So yeah,
Thank you.
we have spoken a lot about diet things, hormonal imbalances, how to correct your gut health, how to correct thyroid issues, PCOS, weight loss, and everything. So tell us, ma'am,
Yeah.
one final question for this interview is very simple. Via
Mm,
this interview,
mm.
if you want to tell any kind of message to the society, it may be to the kids, middle-aged person, or elderly person. What is the one particular message that you wanted to convey to the audience via this interview right now, ma'am?
Yeah, I really feel this. I should give this message to all the audience. See, because of the social media as it is growing, a lot of influencers are growing. A lot of people, those are giving diet advice, food advice, who are not professionals. These things are also growing, and people are falling in these traps. Even the network marketing thing is full fledged. It is running on. They have lot of the sponsor, the franchises of like there's a those are celebrities are also supporting them, but there is no science behind it. So if somebody is telling you to buy some shakes or fall into this network marketing trap, just avoid it. Go natural or don't go do anything. That's okay. But don't do this also. Okay. And apart from that, before listening to any influencer, before listening to anyone giving you any kind of health advice or diet advice or anything related to health advice, then please make sure you're cross checking the background of that person. You're cross checking whether that person is eligible to give me advice. You're checking his professional credentials, you're checking his education background. That is the most important thing. And whenever you're buying some products, try to understand what ingredients you're taking. The simple thing is, see, if there is no one to explain you, if you're buying some product, we never read some packaging. We never read some. Most of the Indians don't read packaging. So whenever you're buying some food, take a snap of it, take a pic of it, upload it on Google, Gemini, or ChatGPT anywhere, and try to understand whether they are healthy or not before purchasing any processed food. So that way, even you will analyze, you will understand what is good and what is not. So don't depend on anyone. Means like just take a recharge that your health is your responsibility, and you're going to make sure you're not taking anyone's advice simply. Just cross check everything. Let it be a product, let it be a person giving you advice. Just cross check and only then go further with it, because it's about your health, and which if once it's gone, it's not going to come back easily. So be conscious about it. That's it.
Of course, that's the thing which we are advised right from our childhood. Whatever you're going
Yeah,
to do, just cross verify it. So if it's good, then
yeah,
you can take it. But without cross verifying it, do not kind of go and kind of believe it bluntly. And also at the same time, you told a very wonderful message that whatever you're trying to intake, make sure that you have make it happen naturally instead of going and finding some kind of artificial projects and
yeah,
which most of the people actually go for many artificial flavors, many artificial kind of things. But there are also
yeah,
foods that actually there are existing in our society, but it's not too much like given to us. Of course, there is a lot of foods, but in today's world.
Yeah, just simple one example I'll give. Recently, I've
Yeah,
made one reel also on that. Like during COVID times, no, all were crazy about vitamin C tablets, right? Everyone was chewing it like it is a toffee. But our daily requirement of vitamin C is just 80 milligram to 60 milligram. Like that's the range, 65 milligram to 80 milligram. 65 milligram for women and 85 milligram for men. But the vitamin C tablets, they were coming into 500 milligram, which is excess, which is almost six times more than your daily requirement. And we are taking it daily. We were taking it daily, right, during the COVID times. We have not cross checked. It was just, like a fad. Everyone was telling you have to build your immunity, you have to take vitamin C. So we were not relying on foods. One amla will give you around more than 100 milligram of vitamin C. Even one guava will give you 85 milligram to 100 milligram of vitamin C. One orange will give you 80 to 100 milligram. So one fruit, if you eat, that consumption is enough for your daily requirement. You don't need to go for supplements. So these things are not known to people. They're just running behind what is been shown on in social media, what has been spread any like anything. So you don't have to believe all that. Just cross check whether you're taking it is right or not, or whether it was advised by a healthcare professional or not.
yeah, that's a very wonderful message, man. That was the right thing that I was trying to say, because most of them, when you step out of your home, then you will be seeing a lot
Yeah,
of fast foods, you'll be seeing a lot of
yeah,
restaurants, but also at the same
mhm,
time, people think that some foods will be accessible, but they have to travel to a supermarket for some good fruits. As you told right
yeah,
now, vitamin C is very much available in amla, but the most of the people
yeah,
will be just seeing it. They'll not be kind of their mind will not be going to it, because we are not actually used to it. So people
yeah,
actually
yeah,
they are used to many fast foods and many kind of things. But yeah, as you told, that each and every food, like probiotics we can see in curd, that's a very simple food item. Vitamin C we can
yeah,
see in amla, that's a very simple food items. Of
mhm,
course, flax seeds and sunflower seeds are actually, like, it's not that much, like, too much used by us, but that's a very wonderful thing. But it's available in the market
yeah.
nowadays, it's available everywhere, like small.
And most of these things are also cheaper than the supplements. So
Exactly.
why go for supplements?
Exactly. Amla is very, like, compared to supplements, Amla is little bit like
Very low.
cheaper. That's a
Yeah.
good thing. So yeah, great. We have spoken a lot about many things for to you in this kind of interview. That's a very wonderful interview, ma'am. So yeah,
Thank you so
thank
much.
you for once again having me host this interview. We had a very wonderful session. And the people who are watching this interview right now, please do subscribe to our Women Today YouTube channel. Please click on the bell icon so that you can receive notifications whenever I do post new videos regarding women entrepreneurs and working women across different cities in India and also across different countries in the world. So today's your host is Krishna, hosting this Women Today YouTube channel. Today's our guest is from Sangli, Maharashtra, a dietitianist. She is the founder of Blossom Nutri Hub, and I'll mention her Instagram page right down in the YouTube description. You can just go click, and people who are wanted to have your diets charts planned, if you're having any kind of issues with your gut health or any kind of things, our Anjum ma'am is here to help you out. I'll mention in Instagram. You can just directly contact her and make a conversation to have a very hair and healthy life. So thank you once again, Anjum ma'am. So thank you for just
Thank you so much.
having me in this interview. So good evening. Have a nice day, ma'am.
Thank you. Thank you.
Thank you, ma'am.